Thanks for having me on for this interview. And with regards to some of the outcomes that we expect from the CMO meetings is other than health system strengthening, there are a lot of topics on health system strengthening. One of the things we want to deal with is the area of health workforce, how we deal with that, because as an emergency situation, it's been here for a while, but it's been a bit worse recently. And how we are able to overcome this the health workforce in the Caribbean. And we need to look for unique solutions. Yes, different member states are looking at different areas to solve the health worker workforce crisis, but we need to come up with some common situation on how we can help to reduce the impact of the shortages that we are experiencing in the Caribbean. Guyana have a unique situation where we have introduced what we call a hybrid nursing program, where we're able to almost triple not triple, but increase the output from nurses by five times, when compared to prior to 2023. So there's a solution we would like to know that other member states can follow. They can, and who there we can go to now that where we can recruit from. And so we need some common decisions. And that's one of the other things that, other than health systems, we can be able to come out of this CMO's meeting and agree on something in the area. Among the Caribbean, NCDs is one of the biggest challenges among the Caribbean member states, not only in Guyana, but most of the Caribbean member states have a big NCD burden. And with the challenge with what's happening around globally with decreased financing from other international organizations such as WHO and PAHO and other, we need to come up with a common solution, how we can work together among ourselves to help this, because we can't always depend upon what has happened and the grants and the support that we used to get traditionally. So as member states, we need to come to some common solutions, some common policies, some common ways how we could collaborate among ourselves to deal with this NCD burden. So I think that's one thing I hope to get out of this CMO's meeting, some common decisions.